Okay, and we are live in 5, 4, 3, 2, 1.
Good evening, everyone. This is Amy Tomlinson with Lake Cumberland District Health Department. Are y'all hearing me okay?
Yes.
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 Okay, perfect. I'm going to ask the chair then to go ahead with his meeting, and I will just chime in as he needs assistance or as it's my turn on the agenda.
Are you okay with the roll call as you can see on the screen there?
Sue, do you want to do a verbal roll call just for the record? Do you want to go down the list and
Yes.
if we miss anybody?
Judge John Frank.
Yes, I'm here.
Mary Despain. Shane D. Simone.
Here.
Mark Risen.
Here.
Pam Bills.
Here.
Charlie Allen.
Here.
Garth.
Here.
Paul Patterson.
Here.
Linda.
Here.
Dr. Shuffett.
He's here, but he's muted. Debbie Bradshaw. Teresa.
Here.
Okay, it's got it.
Okay. Well, thank you everybody for coming in on a February night here, and we're kind of waiting on our virtual meal. I think it's going to be here in about 35 minutes. We want to
maybe this is the last one of these we'll have to do virtually, and we can all get together and eat a good meal for real.
well, Amy, we want to welcome you to our meetings, and glad to have you on board here with us. And of course, we've seen Ron a time or two, so
yes, I thank you very much for making me welcome.
We'll start off with our old business and approval of the minutes from February 2021 meeting. And do I hear a motion to approve?
I'll make a motion.
I'll make a motion.
Need a second?
Second.
Okay.
Did you get that, Sue? Sue's going to take minutes, so I want to make sure she's recording everything to get the names.
If y'all wouldn't care, just sometimes the Zoom doesn't register. If y'all wouldn't care just to call out your name when you say the motion. When you do that, you don't have to do it obviously when you say the all those in favor, but when you do the motion, please call your name.
All in favor, say aye.
Aye.
Opposed? Okay, we got that done.
It was the second. I'm sorry. I was on mute.
Mary
I saw
Despain.
Pam. Oh, okay. Pam and Mary both, I think, did. So.
Thank you.
Let's see. I'm kind of making some notes here too. Now we need to, was it Ron, were you going to present the financial statements?
Sir.
Are you going to present the financial statements?
Yes, sir, I am.
Okay. I'll turn the floor over to you.
Okay, thank you, sir. I'm going to share my screen. Can everybody see this screen?
Yes.
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 Okay. In prior years, we had always sent financials sometime around August and September, which is of course not always possible due to auditing and closeouts of district financials and things like that. So it's not always feasible to do that. And since I wasn't going to be able to send financials till about October, November this year, I decided to go on ahead and start including all the financials in the February meetings. So that way you had the financials officially in your packet. And then also it gives you a chance, if you have questions about the year-end financials from the prior year, to to be able to ask those while I'm here. So I'm going to start doing that now each year. But I won't spend much time on them. I'm not going to go through each line and category, but I did want y'all to see a picture here. For the fiscal year ended June 30, 2021, here was our financial statement. We had receipts totaling $186,098. That was from the normal receipts that we get every year, real, tangible, or motor vehicle taxes, and of course, delinquent and some telecommunications taxes, which is the other taxes, and some interest income from your bank accounts and the CD. We also had expenditures of $152,898. That, of course, is a lot of your normal categories as well: advertising, professional services, maintenance and repair, district management fee that y'all pay to be part of the district, a little bit of materials and supplies, dues and subscriptions that you normally pay to be part of SPGE, CalBO, KPHA, things like that. Grants and donations, the same grants y'all have done for the last few years, the farmers market, building improvement, some building improvements and some equipment purchased. Here is if you see that left you with a cash balance at the end of as of June 30, 2021 of $240,037.38, which is reflected on the next sheet, which is the balance sheet. So I won't go into detail there. It just shows you a breakdown between your checking account, your little B5 primary share account, and the CD account that we have for you. This one's probably something you'll be a little more interested in. I'm not going to go through once again line by line, but this is the same receipts and expenditures I just went through in summary form, but now compared to what we budgeted. So as you can see, you guys did very well. Even though COVID was here, we still, it didn't impact. In fact, it helped. In some cases, it helped some things for the health department financially. You did have except in one category, you exceeded more revenues than we budgeted in all the categories except for telecommunications, which is a very minuscule difference anyway. It almost broke even there. And in all categories of expenditures, except for building improvement, but the building improvement you see there, that could have been labeled under building maintenance and repair, which we did have plenty of funds to cover that in. As you can see up here, for under maintenance and repairs where it says 7,900, we have plenty to cover that in there. So you technically didn't go over budget in that category as well. That it shows you had a surplus of 33,200 in fiscal year 2021. There just wasn't a lot going on. Thankfully, there wasn't a lot of things that had to be done to the building or HVAC units or repairs. It's a pretty good year. It obviously be a lot less if we had some things that were needing to be done, but it just didn't have a lot happen in last fiscal year. And I believe that is all for the financials.
Okay, I'm going to scroll back up here to the agenda here. Give me a minute. Does anybody have any questions on any of those financials? Okay. The next thing we need to do is look at the setting the tax rate. And let's see here.
I'm gonna chime in and say that I think Ron's gonna handle this part also, and we'll kind of do it hand in hand with approving your budget. So we'll go ahead and look at the budget. If you adopt the tax rate that you currently have and keep it, or if you wanted to do a break-even budget, what that would look like, or a surplus budget. Ron presents this 3 different ways, so you all always have a choice. So if that's okay with you, Mr. Chair, we'll just have Ron continue on with his discussion.
Great. What page was that on? I'm trying to scroll through one computer and watch you all on another here.
Yeah, I'll have the, if you're talking about what page the budget's on, it's page 7 to 21. If you want to look at your packet in front of you, but I'll have everything on the screen for you if you want to use
Okay.
it. But if you have it in hand and want to use just your hand packet, it'll be on page 7 of 21. Just to add to what Amy said, we always want to present the budget. We technically have to approve the tax rate after we're done with the budget presentation first and then approve the budget, but we always want to present the budget first so you can see how the tax rate works inside of the budget so you can make a better decision on what you want to do. Of course, the last many years, you guys kept the same tax rate. And of course, as you can see, it's led to a surplus this prior year, has led to, I'll show you in a second, but it's led to a surplus in years before that as well. There has been, I think, a few years of deficit, but the rate has served you well so far. As you'll see in a second, I think it's going to continue to serve you well, and I'll explain that here in a little bit. But of course, that'll be y'all's decision whenever we get to that approval. I'm going to start up here at the top. The balance for the opening balance calculation here to show how we are going to arrive at the cash for the upcoming budget year. Your balance as of December 31st, 2021 was $241,980 in your checking and $35,740 in your CD, giving you a total cash and check and CD balance of $277,720. We project that the rest of the year you will receive another $56,985. That, of course, being a combination of real estate, motor vehicle, property taxes left to receive there. You have some projected interest earned, once again, based on your current cash balance and remaining receipts from some CD and checking of a total of $787, giving you a total projected remaining receipts of through June 30, 2022 of $57,772. And that would leave you with a cash balance of $335,492 before any expenditures are spent. The expenditures we are projecting for the remainder through June 30, 22. And keep in mind, a couple of these I'm going to go through, and I'll highlight that in a second, could be inflated because the remaining expenditures I'm projecting are based on budgeted less what you've already spent. And as you've already seen, we have some cushion we always build into the budget for miscellaneous costs, just in case there's repairs or equipment or things that are needed in emergency situations to get done for the building, and so you don't have to call a special call board meeting for that to take place. So there's for multiple years in a row. Sometimes you don't spend all those categories, so that's why there's a chunk left over. But I still plan for the worst, so I still want to show it as being spent through the rest of the year. So your first category is your operating expense, which will be the second half of the district fee you pay to be part of the district. We've already paid the first half back to the district in November, December range, and you'll pay the $72,674 sometime in May or early June. A little bit of advertising remaining to spend of $277 for the year. You didn't have an audit, so you're not gonna have any audit money to spend there. You have a little bit of maintenance or a chunk of maintenance and repair. Once again, this is based on what you budgeted. So you budgeted kind of a chunk of maintenance and repair with miscellaneous cost involved and everything else. Leaving that if worst case scenario, you would spend $21,072 by the end of the year. You will be spending this probably, the dues and subscriptions, this will come to fruition. We still have to pay Calbo. So you will have another fee there to round out another $1,200. You have a little bit left to spend in the farmers market grant projected. I can't remember if they're technically done with that grant and we just weren't able to spend all the costs, or if we still have a little bit left to spend. But either way, we budgeted $4,000, and there's a little bit left remaining in that. The board expense and our miscellaneous, there's a good chance we won't spend this. If you remember, that board expense of $500 represents the normal food cost we have and some other miscellaneous things, but mostly the food cost we have for having these board meetings. Of course, we were doing it on Zoom, so we didn't We didn't spend that. We didn't know how this year was going to look. We'd certainly hoped to be together and be live in person, but we weren't able to do that again, unfortunately. So that's more than likely going to go back into your budget unless there is some unforeseen cost that does not fit in any of these other categories come to place and we have to put it there. There's a remaining furniture and fixtures of $4,243 and equipment left to spend of $10,672. Once again, those are worst case scenario numbers. Leaving you of paying a total of $110,946. And that would give you an opening balance as of July 1st, 2022 of $188,382 in your checking, $36,164 in your CD for a total cash balance of $224,546. Now, I'm going to present the budget at your current rate for all the reasons I said earlier, for the main reason that you guys have accepted this rate for many years in a row. This rate has served you well. Obviously, when I'm done with this column here, this middle column showing your current rate, I'll show you the result total from break even and surplus, which of course will be up to y'all how y'all want to handle that. I'm going to start with the receipts in the current rate here. We are projecting that you will receive a total real estate tax receipts of $130,520. Personal property or tangible property, whatever you want to call it, of $17,017, and motor vehicle taxes of $23,462. Those three sets of numbers, as we explain to y'all every year, but for those who have not been on before or who have not seen this come before, those come from this sheet that we're provided from the Finance Administration Cabinet, which actually comes, we actually get it from the state. The state gets it from the Finance Administration Cabinet Office of Property Evaluation for your county. We take the numbers in those three categories and we plug those in to our calculator sheet here. We can basically just copy and paste those numbers over. We plug your rates in that you have been using. When that happens, we have a calculation down here that shows your total cost, which will be here's your current rate right here, 0.034. And we fact here's the numbers that it shows at a 95% collection rate, because we always factor in there's a good chance you may not collect every dime of those property taxes. So we back that down just a little bit to give more of a realistic picture. And that's where these numbers come from. The delinquent tax collections, these are the hardest to estimate. They vary by county and they vary every year inside the county. Sometimes I see a county receive 6,000. I'll see the same county the next year receive 1,000. It really just depends on the timing and everything from how that's billed to just what's been done in the county. Based on this current year we're in, I'm projecting you would receive 3,000 next year. Your telecommunication tax, I'm projecting $1,300 you'll receive next year, and interest income from CD and checking, which I do not understand why that is not shown up on my computer, but there is a little bit of interest here and CD. The total interest between checking and CD, there's something getting cut off there of $1,370. I will fix that whenever we have a budget approval. But the total interest will be $1,370, and giving you a total budget of receipts of $176,669. That would give you a total funds available before expenditures of $401,215. The projected expenditures that we have budgeted for the upcoming year, 2023, year ended June 30, 2023, is $148,234 for the district operations fee, the 2.8 cents that you pay to be part of the district. Your building maintenance and repair has a few categories. Normal landscaping and maintenance, we normally budget this every year of $1,000. We have budgeted for a new sign this year. If there's any questions about that, you can direct them to Sue. For $5,000, and a miscellaneous cost that we normally budget every year. We normally creep this up a little bit about every year, every other year, because we normally want to have a little cushion in case we have to, have something goes wrong with the building, especially like an HVAC unit. Those are becoming so pricey nowadays. We want to budget for at least one or two of those in case those go down. That's why we have a $15,000 miscellaneous. Furniture and fixtures. We're budgeting new furniture for one of our traveling nurses that's going to be in the county. For where they're going to be, where they're working there, are going to be working there, and normal miscellaneous costs in case something comes up that we need for furniture. 4,500, giving us a total furniture and fixtures of 9,000. And then we have miscellaneous in equipment. We have miscellaneous computers and related equipment. A couple years ago, I had decided with Sean's approval to start breaking out two miscellaneous categories in equipment. The reason we did that is we started running into issues of not being able to hit budget for different reasons because the normal miscellaneous category looked too inflated. And then we really didn't have a good breakdown of what was really going on in the equipment categories. Since most of our equipment is computer related, this first category is miscellaneous computers and related equipment. That's anything IT related. So printers, computers, scanners, anything like that. Fax machines is what we're budgeting there for 7,000. If need be, we have if you remember, you guys have an automatic generator now that helps us if the building goes down. It kicks on. It helps us save our vaccines. It powers things like the vaccine fridges and things like that to help save our vaccine in case of power outage. That needs an annual maintenance on it from the guys who installed it to make sure everything's topped off, the fluids, and it's still working in proper order. We do that once a year. And then miscellaneous equipment, other things you might buy, like I said before, or things you could possibly piece of equipment you could possibly put into the kitchen, or like I said, a medical fridge or something the nurses may use back there in their offices or something like that. Just other types of equipment that may need that are not computer related. Giving you a total equipment of 12,500. Normal advertising and printing. This is about the same every year, about $300. Most of these fees from the newspaper and the SPG publication have not gone up that much, at least from y'all's perspective. So 300 should be sufficient for that. Your normal memberships are Calbo, SPG, and KPHA. Those total a little less than 1,500, but in case sometimes they don't tell us their fee increase until during the year. So we always like to have a little cushion there. This will probably be more than likely around 1,300 or so. We like having that cushion because every so many years they always seem to raise their rates. And then, of course, the food costs. If we're able to meet next year, we will spend this money next year, $500 to meet and have a food purchase for the next year's board meeting or anything else that might come up that we need to spend. Giving you total budgeted expenditures of $193,034. That would leave you with a cash balance of $208,181. And that would give you a net deficit before optional expenditures of $16,365. Now, remember what I said before. That sounds like, it's never fun to have a deficit. Remember, we're also budgeting for a new sign. And remember, a lot of these costs, unless worst case scenario happens, that every one of these dollars is spent, which I think normally that's not going to happen. You're more than likely going to actually, in reality, going to be in more of a break-even position at the end of the budget year. But we have to budget, worst case, or not exactly worst case, but a much more realistic picture of what really could happen during the year. That's showing the deficit of $16,365. That's before optional expenses. Of course, you guys do not have to do these optional expenses whenever y'all do the approval here in a little bit. You will after you do the tax rate and you'll do the budget, you'll do an approval of the budget with or without optional expenses. So the optional expenses, this is one we've been doing for many years now. The local mini grant, we're planning to do the $4,000 for the farmers market on Green River again. And we have optional expenses for the building, which Sue can answer any questions about that or elaborate on this, but we're needing to replace the flooring in the building. And that's projected to be $26,000, giving us a total budget expenditures, including optional expenses of $223,034, and a balance remaining, including the optional expenses of $178,181. And that would actually give you a net deficit if you include the optional expenditures of $46,364, which, like I said before, will more than likely be more like a $30,000 deficit if these chunk categories aren't spent at the end of the year. The last thing I'll say is the break-even budget. I'm not going through the categories, but as you can see, the break-even budget here to get you to your normal reality if you really wanted to raise it, which, like I said, I don't think you need to. In reality, your rate has been well sufficient to cover your funds, cover all your expenditures. But if you wanted to raise it to your break-even, it'd be 0.37 cents, so 0.03 higher than where you're currently at. And if you want to do a surplus budget, including everything, all this here, you would actually raise it to 0.04. That is the presentation of the budget. You will need to now go to the tax rate approval and then back to the budget. Unless there's any questions.
I got one question on the, this is Dr. Bobrowski. I know we've typically and historically had our annual meeting in February, but with the fiscal year ending in June 30th of the prior year, do we or should we have our annual meeting closer to the end of the fiscal year? I know it takes some time to prepare documents and stuff like that, but is there any problem by having this? I mean, we've got about half the year or over half the year gone already, but I didn't know if that caused any problem with the record keeping or services or anything like that.
So you're asking if you're, let me make sure I'm correct in this. You're asking, is there anything wrong with doing the meeting for, let's say, for example, budget year 22-23, which we're talking about now, back in like July, about 6 months ago or so, or 7 months ago?
Yeah, like July or August or something like that.
Well, that would be difficult because that's also when all the fiscal court approvals are happening, and that's also when a lot of district things are happening with budgets and audits and everything else going on. I'm not saying just from my standpoint. I'm talking about just globally. It's also a little harder to plan. Believe it or not, a lot of health departments, which me and Sean didn't agree with, but a lot of health departments budget actually even later than we do. They'll budget like in May or June of the end of the year for the next year, like right up to the deadline, because they're trying to get a more true picture of what's going on. They're wanting to see what their district budget looks like. But in our opinion, of doing that just really puts you in a time crunch. If you don't get it in right with everything, the numbers may not line up the way you want. So we always thought this allowed us a little more cushion and breathing room to be able to sit down and really discuss how these budgets can impact our district and what that's going to look like. It allowed us to have a little better timing of that. So that's why we always chose February. It was kind of a good time for us because our entire health department normally, myself and others, we really ramp up from about April to June, and even for a chunk of us, even the first of the year from July to August. So like I said, there's various reasons we've done that. Amy might be able to have another reason, but that's the main reason I think Sean and them decided to do that years ago. It gives us a little breathing room before the end of the year, but not too far in advance where we don't really know how the year's going. By now, we already know at least how many receipts we received, if there are any problems, how many expenditures we spent, to at least give us a projection. I hope that helps.
I think Dr. Bobrowski was asking about that scenario. Ron was more of like asking, and maybe I misunderstood, but Dr. Bobrowski, were you saying move this meeting more toward like April, May, June of this year to talk about next year so that you have a better picture of how this year has unfolded before you plan for next year?
I was talking about like what Ron did was go back, like
okay,
October, September, whatever.
Okay.
Closer to the end of the fiscal year.
I think we had settled on February as our sweet spot because, as Ron said, it gave us over a half of a year's worth of numbers to look at that would give a better projection of how we were going to end and felt like a truer picture, and yet allow time for the decisions we make here to then be reflected in the district budget that also has to go into effect and is due the end of June. So this was kind of the sweet spot that had been decided on, but it doesn't necessarily have to be that way if you all prefer something different.
That's fine. I was just curious. Another question is, we all saw a letter from the Kentucky Department of Revenue where they're going to raise the, I guess, the property tax or registration tax, whatever you call it, on vehicles up to potentially 40%. Pretty steep raise, but do I know we get motor vehicle taxes or a portion of that? Will that help our budgetary appearance when that comes through?
I think they are reconsidering that now and backing that down, and have reversed that and are doing legislation to back that off now, Dr. Bobrowski, because they had so much feedback from constituents and everyone saying that wasn't a good idea. They couldn't handle that. So I don't think that will happen. I know some people that had their property taxes, their vehicle taxes and things due already, like in January, may have had to pay that rate, but it's my understanding that's going to be refunded to them. So I think that should not necessarily affect us. I think anything that we receive should be the correct amount. And if not, they'll correct it, because I think that's been challenged and is no longer going to occur. I don't know if the final vote's been taken on that, but I know it's been discussed.
Well, I'm glad the powers that be listen to the people out here that are working every day.
Yes.
Trying to struggle through life. And well, great. I hadn't heard that, so that's good.
That was a considerable increase that they kind of snuck in there on us.
Yep.
Yes. This Judge Frank, I'll let you know that bill did come out of the committee. It looks like Amy said, it looks like very likely it will pass. So that's going to be a considerable help to everyone involved. So she's exactly right. I did see that late this evening. It's come out of committee, which is a very good sign, and I think it will be they will back off of that huge increase.
That's great. I guess we all still need to call our legislators and tell them we need to vote the right way on this so we don't kill us here.
Yeah, I don't think it would hurt a thing. They've heard a lot.
It's always a good idea. Yeah.
Okay. Are there any other questions on the budget there, or are we ready to move forward on the discussion of the tax rate? And I believe the present tax rate, as it has been for several years, has been 0.034. And if I heard Ron correctly, that we would still be okay to leave it at that rate. If I heard Ron correctly, even though potentially it could run a deficit budget, but the way the cushion is in there, that we would be all right.
I think Ron's showing, he's got several years worth of data here for you to see that historically you've had surpluses every year at this rate, just small surpluses. So it's been a good rate for you all. So there's 1 or 2 years in there maybe that you've had a deficit before and you've still been okay. So I would not be concerned with leaving things the way they are this year.
And it's always nice to have the cushion if nothing bad happens to your building, because that's what the cushion's for. If something drops off if the roof falls in, or like you have multiple units go out, which we've had in multiple counties, multiple years at times, you have 2 or 3 units go out. Just bad things happen, real bad leaks happen in buildings, and just a lot of different things go on. It's good to have that cushion, and more than likely you will be in deficit this year if y'all include the flooring in your budget. But like I said, based on your current thing, you can see that, as Amy was saying, it's a really good trend you've been having. So I think it's sufficient, but of course that's completely up to you guys.
This is Dr. Bobrowski again. It's just it's just been my philosophy that we raised the the tax rate several years ago in order to build our addition. And we had all agreed that once that addition got paid off, we would move the tax rate back down to the original, which is the 0.034. And I felt like our board kept our word to the public on doing what we said we'd do, but at the time we needed more room in the health department. So, and personally, I don't have any problem with suggesting to leave it at the 0.034 rate, but the floor is open for discussion. Don't hear any, so would somebody want to make a motion to leave the tax rate at the 0.034?
Teresa Collison, I'll make a motion.
Mary
Harrison.
Despain, I'll make a second the motion.
Thank you. Any discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? All right. Thank you all. We've got that. Now let me go back.
I think we'll move now to the approval of the budget, Dr. Bobrowski.
Yeah.
And
There we go.
as Ron mentioned, that would be with or without those optional items at the bottom, which included the farmer's market grant and the replacement of the flooring in the building.
Okay. Is there any discussion from any members on that?
This is Charlie. I've personally looked at the flooring myself, and it does need, there's a lot of work that's needed there with the flooring. Some of the tiles coming loose. A lot of the luxury vinyl plank or laminate that was used previously is really damaged and not holding up very well at all.
I went and saw it also. This is Mary Despain. And I looked at it, and it is where the traffic is. It's really showing wear, and it's been cleaned, but it hadn't helped it.
Was that some of the new flooring they did when they did the remodel?
Yes, it was. That vinyl just didn't hold up.
Garth, some of the tiles are coming up in the kitchen flooring and the back area where the new part of the building is. The carpet is really soiled, and Pam has tried to clean it, but it's just not coming out.
Okay. So we need to vote on this on our budget then for to leave in the optional expenditures. Is that correct, Miss Amy?
Yes, sir. If you want, whoever decides to make a motion, they would motion that the budget be approved with the optional expenses, and that would suffice. We would then know that that included the farmer's market grant and the $26,000 for new flooring.
So has the sign, does that include the sign?
The sign is in the regular budget. It doesn't require a special motion. It's not optional. We do need to do that. So it's a line item in the full regular budget.
Okay, so it's already budgeted.
Yes.
I need to give full disclosure on something. This is Charlie, by the way. So I originally submitted a bid for replacing the flooring. I thought I was going to have time to actually be able to do that project, but since then things at work has changed, so I won't be able to even do that project now. So I was going to recuse myself from even this discussion, but now it's not looking like I'll be able to do the work anyway.
Thank you for disclosing that, Mr. Allen. I appreciate that.
Well, I make a motion that we include the optional expenses.
Second it, Paul Patterson.
Okay. Who seconded?
Paul Patterson.
Oh, okay. Thank you. Is there any discussion?
I'm not sure what proper procedure is here, but I think Mary, if you want to make your motion in such a way that you motion to approve the budget to include the optional expenses instead of just include the optional expenses, that would cover it all in once and we don't have to vote multiple times.
I make the
I'm sorry.
motion. I'll make the motion that we include the optional expenses to the budget.
I second that.
Any discussion? Hearing none, all in favor, say aye.
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 Any opposed? Hearing none, it passes in, okay. Now we're going to move on to the board members' terms that are expiring. And that is Paul Patterson, Charlie Allen, Glenda Bagby, Mary Despain, and Mike Shuffett. And I'll just ask all of you right now, since you're all here, are you willing to serve another term?
I am.
Mary Despain? I will.
Mrs.
Paul
Glenda,
will.
I will.
Paul will.
Charlie Allen will.
And Paul.
Mike? Dr. Mike?
Yes, I will.
Okay. I know sometimes when we got everything on mute, it takes a couple of seconds to get to the unmute button. Okay. So we've got all of our board members that they all 100% say they will come back.
Wonderful. That process now has gone to an online system. So toward the end of the year, I'll ask Ms. Sue to get with everyone and make sure that they've got their submissions ready, and she can help complete those for those that need help. And it'll be just an online registration form for this instead of a paper form like we used to use. So should be pretty simple. It's the same information that's always been submitted, and I'll have Ms. Sue coordinate that with everyone a little bit later on.
Okay. Since everybody's in agreement, I don't believe we have to do any vote on that, do we?
No, sir, I don't believe so.
Okay. We'll move on then to the election of officers. So we've got a chair, and let's see, we've got a secretary, is that right?
I believe we have the chair is you, sir, and the vice chair is Paul Patterson, and we have Mary Despain as treasurer, and then Mr. Crabtree had been serving as a non-voting secretary to the board. That really just allows the director to sign paperwork and maybe do business on behalf of the board to save some legwork of having to chase people down for signatures and things. So if that's the desire of the board, I don't mind to continue doing that as secretary. That's something you all can decide if you would prefer someone local to do that, or if you would rather me do that. I do it for the other county boards. So,
Amy, I am going to interject here. And this may be something I didn't tell Amy, but the grant, you guys were the only ones that did not have Sean as your secretary. In prior years, you had Stella. You used to do it, but if you remember our last board meeting, Sean had recommended that the next year, whether it was him or a new director, would to put in as the secretary. And for all the reasons Amy said, it having somebody at the district office as mainly the director it allows you to get more things done without having to put any of the onus on you guys to do it. It allows you to do a lot more of the paperwork side of it without having to worry about that you guys have to worry about it. All other 9 counties do it, but once again, that's completely up to you guys.
Well, the floor is open then for nominations for I guess we'll just start off for chair, and then we'll go to vice chair and then secretary.
I make the motion, Garth, that you do the chair, if you accept it.
I'll try one more time.
You're good.
All right, then vice chair. We'll vote on this as a group here in a second.
Okay. Paul, will you do vice chair again?
Yes, if y'all have me.
Okay.
And then the secretary will be Mary.
I think Mary had been serving as
No,
treasurer.
Treasurer. I'm
The
treasurer.
treasurer. Yeah.
We have the motion that Amy do it, or
Yeah, she would be the
That was my
secretary to the board.
suggestion. Yeah.
yeah.
So Amy, yeah. And she said she would do that, so that will put a check mark by her name.
Okay.
And then treasurer is Mary.
Right.
Okay, so you would just have a motion on that slate then, I guess, if anyone else, unless you have other nominations, if anyone else wants to nominate someone else.
Okay, hearing none, we just need to have a motion to accept that slate of officers. So we'll need a motion and a second.
Teresa Collison makes the motion to accept those individuals in those
Glenda.
positions.
Glenda Bagby, second.
Okay, any discussion? All in favor, say aye. Okay. Well, thank you all, and we'll try to do the best we can. The CD expires, and we need to, I guess, Ron, do you want to talk to us about that?
Sarah, hang on one second. I'm pulling back up my document here.
Respiratory 222.
Okay, yes, I'm sorry. I had to remind myself on what we're doing here. The banks are very finicky on how they allow people to talk to them, whether it's a checking CD. Some banks you can go in and, it's the old school method of, yeah, I know you, I'll get you what you want. It doesn't really matter what they have on file. And some banks are so tight knit, you can't go in there if you're the brother of the president. The banks have recommended whenever there is somebody who steps down, that we make a motion, boards make a motion to include a clerk manager. And I am saying clerk manager instead of Sue Taylor, because Sue is now the replacement of Stella Durrett. Because if you put a name in there, you have to make a motion every time that this happens. But if you guys make a motion to have the clerk manager of the Greene County Health Department to be able to have reading and viewing access on the CD account, it will allow her to be able to talk to them about the CD and be able to make a decision on upgrading your CD at a bound, of course, at y'all's discretion. It'll allow her to do things without having to have you guys call and do that and bother you with it. But the motion would have to be along the lines of you motion for the acting clerk manager in Greene County Health Department to have reading and viewing access on all checking and CD accounts of the Greene County Public Health Taxing District.
Okay, is everybody, I'm following you. Is there any questions on that? Well, we'll need a motion then to include a clerk manager of the Greene County Health Department to have reading and viewing access on all of our CD accounts for our health department. And I believe I've restated that pretty close. So I need a first and a second.
Make a motion, Paul.
Hey, this
A
is Charlie.
second.
I can make a motion to have the active clerk manager to have viewing and reading access on all check and CD accounts of the Greene County Health Department.
Now, I'm sorry, Charlie, did you second Paul's motion, or were you going to be the first?
I don't know. I read it. I read the whole thing and as if it was making the motion. So it's
Okay, Paul beat you.
Did he? Okay. I'll second it then.
Okay.
There you go. That'll work.
So Sue in the minutes, you will put checking and CD when you write it down. Okay. And you need to put Greene County Public Health Taxing District in there. Okay. When you write it down. Thank you.
So I believe you have a motion and a second then.
Okay, I'll just make one more note here. Okay, because we've got a first and a second. Is there any discussion on that motion? Hearing none, all in favor, say aye.
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 Any opposed? All right, thank you. Now, I guess we need a separate motion then to remove Stella from the bank accounts and add Sue and Ron. Is that, am I following the? I'm sorry, I didn't.
That would be correct. You need to make a motion to remove Stella, and that's another reason why we like having clerk manager in there. It keeps you from having to also remove a name moving forward. So you don't want her to be able to have viewing access anymore, since she's not part of the taxing district. Yes, you need to have a motion that says that you want to remove Stella Durrett from all reading and viewing access from all bank accounts of the Greene County Public Health Taxing District.
I make a motion, we remove Stella as the clerk manager. That's Mary.
Okay. Got a first. Do we need a second?
Mike Suffolk, second.
Okay, any further discussion? Hearing none, all in favor, say aye.
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 Any opposed? Hearing none, the motion passes. So, now, clarification, did we, in that motion, did we need, it said to add Sue and Ron, or were
No.
we were good with just leaving it as?
Yes. Yeah. I may have told Sue that accidentally or something. I don't need to be on that since technically I don't have a tie to the taxing district. I'm technically fully for the district or with the district, so it probably wouldn't look right if I had a tie into the taxing district. So
Okay.
I can help her with that, but she'll be the one to call.
But I was just going off the notes on the
Correct.
agenda sheet. So we're good with leaving it at clerk manager.
Yes.
All right. So we got that good. All right. The next item is farmers market grant. And I believe we've included that in our budget. So what else do we need to talk about on that?
Is Judge Frank here?
I think he just dropped off. I saw him a second ago and now I don't.
I think that Judge Frank's the one that oversees the farmer's market. I was going to ask if they moved out to the Cattlemen's Association to have more access other than being at the park. Since he's here and we don't really know, I don't know if we could put this on the panel, or I don't know how you all do this. We have a sign at the park for farmer's market, and I didn't know if it needed to be moved out to the Cattlemen's if that's where they were going to be.
I think the group could just make this something for you to follow up on, Sue. I don't think it requires a motion or anything like that. So maybe we just discuss, and the chair could then instruct you to follow up with Judge Frank. And if it needs to be moved, then we'll see about moving it.
Okay.
I agree. It's just wherever they move, they need their sign. So
That's right.
go ahead and just check with Judge Frank there, and if it needs to be moved, let's just make it happen.
Okay. All right. Thank you.
And then we got our health educator. Comments?
Good evening. This is Tracy Aaron again from the district. I just want to give some updates about health education in Greene County. We have started doing some virtual school programs that started in January, and we have been doing some in Greene County. They are going real well. We have been working on updating data for our district, including Greene County, and I encourage you all to look at our website. February the 21st, our updated community health assessment addendum will be there, and there will be new data. As I look through Greene County, actually several areas have improved over the last couple of years in regards to data, but I do encourage you all to look on our website for that information. We also are going to be working on the community health improvement plan, and that should be done in March. A few years ago, before COVID, the coalition there agreed upon some priority health issues, and we'll go back and revisit those, but to make sure that we're still on track and we still want to work on those particular areas in Greene County. At that time, they chose substance use and chronic disease as issues to address. So we'll go back and revisit that hopefully in March with the coalition and come up with a plan to improve the health in Greene County. Let's see. And that's just a really short overview about health education and what we've been doing this past year.
You said, just for my notes, substance use and what was the second one?
Chronic diseases.
Yes, okay. Thank you. Anybody have a question there for Ms. Tracy? Okay, thank you very much for that report. And then we've got next diabetes.
I think they were not able to join tonight. They had other obligations and things, but they provided you all with some handouts, I believe, in your packet, some facts and numbers about the diabetes rates in your county and some of the activities and things that they have been involved with. And if you all look at that and review it and have any questions at all following your review of that, you can reach out to Sue or Kayleen or someone there at the office, and they can get in touch with the diabetes staff here at the health department, and they can clear up anything that's not clear to you.
That is on page 20 and 21 of your packets.
Okay, thank you all. Anybody have any questions or comments on that section? All right, we will go ahead and have some comments from our director, Miss Amy.
Thank you, sir. I will try to be very brief. I know we're all waiting for our virtual dinner, so I want to make sure you all get to the table and get your food. I just kind of wanted to take a few minutes and introduce myself to you in case you hadn't had an opportunity to meet me before. With COVID and everything that's gone on, I have kind of hit the ground running with this health department director role. I've been with the health department for 17 years, so it's not necessarily that I'm new to the health department. It's just that I'm new to the director role. The district board appointed me, I think it was the middle of June last year. And then Mr. Crabtree actually physically retired officially the end of July. And I became solo director on August the 1st. So that overlap period of about 6 weeks or so allowed me some time to transition into the role and work with Mr. Crabtree and learn from him and kind of get my feet wet while he was still around. And I greatly appreciated that. And then on August 1st, as I became solo director, that's when Delta variant hit of this awful COVID pandemic that we've been dealing with forever. So it's been almost impossible for me to get out and travel, and do things that I needed to do to meet people and to get out and get to know all of you all. So I do apologize for not having met you all in person before now. COVID is, of course, still going on across our region. I'll try to hit some high points and numbers on that very quickly. I know everybody's tired of dealing with it and tired of talking about it, and we all just wish it would go away at this point. But the positivity rate for the state is actually decreasing. Omicron hit around the first of the year, January, so we got through Delta. Everything kind of had settled down a little bit. And then over the holidays, Christmas and New Year's, right around the 1st of January, Omicron arrived, and that was a complete game changer. That was a increase in transmission like we had not seen with any other of the variants or the strains of COVID. And thankfully, the strain did not appear to be and doesn't seem to be as deadly or more deadly. If you're vaccinated, there's still protection from serious illness and everything. So the vaccines is not keeping people from getting necessarily sick. It's keeping us out of the hospitals and from death. So that is still the purpose of the vaccine, and it's still working. Around the first of the year, also, some changes happened with quarantine status. You all can remember we used to quarantine everyone for 10 days or so, isolation 10 days from a positive case. Some of that guidance changed, and then it went to 5 days of isolation and quarantine. And then on the 5th day, if symptoms were improving or you could test out or whatever, and then you continue wearing a mask for the remaining 5 days. So it was still a 10-day period, but you were able to shorten that a little bit and go back about some of your normal activities. So all of that with the increase in cases that we saw, and also the weather, we had some closure days for the health department and all from snow. And then we've had holidays and first one thing and another. The health department got extremely behind in being able to work the cases. We were receiving 700, 800 cases a day being reported to us across the counties, which was an insane amount of volume that we hadn't seen before. And this was all with us trying to continue working normal health department operations and not be solely COVID. We're still trying to do normal things like restaurant inspections and WIC and all the other normal diabetes classes and the normal things that the health department is known for. So without pulling staff completely 100% and working COVID, we have not been able to keep up with this surge of cases that has come on. So we received some guidance from the state a few weeks ago, and we have just in the last couple of weeks prioritized our approach, refocused our approach on how we handle COVID positive cases. So we are now looking at not contact tracing every single case any longer. And this is saving a great deal of time. We have refocused our efforts and tried to double up on education. We've put a whole bunch of information on our webpage and tried to make it much more user-friendly on what people should do when they are positive or when they have been exposed, so that information is really available and at their fingertips. We also created a calculator so that people can go to our webpage and put in their date of their symptom onset or the date they tested positive or the date of their exposure. And it will then calculate out how many days they should look at isolation or quarantine, what their options should be, what their instructions are, and all that. So we did a media brief last Wednesday, I believe it was, and promoted that out to our communities and have sent that out to all of our partners across the communities that we have contact information for, so they know that resource is available. It has been viewed a lot of times. I don't have the demographics or the analytics right here in front of me on that, but I had the IT guys pull some of that information for us the other day, and it had been very obvious that it is being utilized. So I'm thankful that we were able to do that and get that information out there. So the health department, now that we are not contact tracing every single positive case, we are focusing our efforts on those that are most at risk. So we have pulled out congregate care settings, long-term care, people that are over 65, people that are in situations where they're in close quarters together, like dormitories or school systems, or those types of situations where we have much more risk of transmission from people being close together for extended periods of time. And that's what we're working. And we're treating this at this point in time much more as just a regular outbreak situation. So like you would normally see us at the health department going in and investigating when there's a norovirus outbreak at a long-term care, or in a school, or a flu outbreak, whatever. We are treating it kind of like that, as just an outbreak situation. So when we are noticing clusters of positives outside of a household, but in a certain setting, that's what we're focusing on and looking at now. And that's working out well for us so far. We still have a really good partnership with our school systems. They have been really good to us and to work with us from the beginning of this, and we've offered them guidance on as much as we can throughout the entire duration of this. And I think it's working well, the approach that we've adopted and are moving to. It's allowing us to get the backlog of cases that we haven't been able to process worked and get those through. The thing with our reporting, you all may have seen our reports. We've done a public information brief from the beginning of COVID. And having said that, we, during the surge, have not been able to keep up. And so it has skewed our numbers somewhat on the local level. So where we used to tell people initially that they should trust our local numbers more so than the state, because the state initially had a hard time catching up and getting 120 counties worth of data compiled in a timely manner and all that. They have now updated their processes and have much more streamlined approaches to get that done, and are much more reliable on that data. So we are asking our communities now to use the state data and not necessarily ours. We've stopped publishing our local numbers as much and relying on what the state is reporting for our local cases, which is very accurate at this point in time. But it looks a little different on the approach that we've taken. And if you notice anything different on it, that's probably why. It's this whole different ballgame with Omicron and these numbers of cases and things that we're seeing. So I don't want to take too much time. I know I've spoken already like 10 minutes or so on COVID. I could talk forever on COVID because that's been my life for the last 2 years, as many of you all also. But besides that, the health department is doing well. We are, as a district, I'm excited because I've only recently been notified and made aware that we are getting ready to celebrate our 40th anniversary as a 10-county district. And that's actually going to happen, I think, July 1st of this year. So we started in 1971 as a 5-county district, and then we added 5 more counties in 1982. So this year, 2022, will be 40 years as a 10-county district. And that's the largest district in the state. And I think it's the longest serving continuous district in the state. So it's quite an accomplishment to keep this many people happy and together and healthy and working as well as we do together. I'm so thankful for the partnerships we have. And I look forward to maybe this summer being able to do some sort of celebration at our sites and inviting you all in and giving you an opportunity to come and meet our staff and interact with them and pat them on the back for the job that they've done during COVID. It has been an unreal ordeal that they've all had to deal with and to go through. The vaccinations, the mandates, all the things that we've had to endure. So we're very thankful for all of you all, and I'm super thankful for my Greene County staff over there. They do a wonderful job. So I will hush, and if you all have questions for me, I'm more than happy to address anything that you might want to ask me.
Any questions for Miss Amy? Well, again, I always want to welcome you on board and swing by Greene County or any of our offices anytime. We'll be glad to welcome you, meet you in person. And but again, it's just like welcome to the board.
Thank you, sir.
Let's see. Now, one other note on the agenda was to appoint you as secretary to Sean retiring. But did we
We took
do
care of
a
that.
minute ago?
Yes, sir. We did take care of that with the election of officers. So that's
Okay.
been accomplished.
I thought we
If
had it
you all
done.
should need to reach out to me for any reason, if you have questions or concerns, please get with Sue. She has my contact information. She's got my cell phone number and everything, and I'm more than happy to talk to any of you all anytime.
Okay, thank you. Does anybody else have any other items to bring up before the board tonight?
I just want to say thank you to all of our board. Everybody has been excellent to work with. I really appreciate you all.
Thank you, Ms. Sue, for all that you've done here, filling in and getting all this stuff ready for us. And it seems like everything's run really smooth. So that's the way we like it.
Absolutely.
And I don't hear any other questions or comments from any other board members. So we will declare this meeting adjourned.
Thank you all. Have a good evening.
Bye-bye.
Bye.
See ya.